Hey everyone, OT Life Hacker here. So, finished my third day of field work, but it's technically second day on the floor in the hospital in acute care. I got to see 8 patients today. We had 9 patients. However, there was 1 patient on bed rest, confirmed bed rest, per speaking with the nurse in charge of them. And so we got to see 8 patients, and I got to do a little of while the OT would go and grab supplies for doing the evaluation, which was I have difficulty at times deciphering if it's evaluation or if it's treatment, because you are doing activities with them, which is awesome, because I feel like many times the evaluation does seem like it is kind of education for them, in a sense, but your focus isn't on having them fix or having them adjust or giving a lot of you're not giving interventions in the sense for, say for example, having them work on changing this, using this instead. You are essentially seeing how they do the task and then evaluating them from there. I had got to document for 2 of the evaluations that we did today, and the conditions that we saw overall were a few more of the craniotomy, and that has to do with a brain procedure, brain surgery, that post-brain surgery that we got to work with the client on in their ADLs, which are their activities of daily living. So in the hospital, that's brushing their teeth and brushing their teeth and washing their face, rinsing their mouth with mouthwash, and washing their hands. It could be combing. We did a little of combing today, and we did a little of just seeing how the person manages their hair, which was putting their hair up in a bun, and a little bit of upper and lower body dressing, did sock aid, showed a person how to use a sock aid and how to use a reacher for lower body dressing. We had, as I said, craniotomy, and we had a few orthopedic cases, meaning in this case specifically it was total hip replacements, and we also had a few heart surgeries, post-heart surgery, and a few more. So I have, what you'll find in my spiels as I'm talking to you guys, I am going to be totally honest in, I may even downplay the good things, because I'm sure you hear that a lot from other people. They may share about the good things that they did, and I'll share if it's relevant to you, if it's worthwhile to share. But for the most part, I will probably be sharing the challenges, the mistakes I've made, because that is one way for me that I learn, by making mistakes. Not saying that's why I make mistakes. That's definitely not why. But I learn from my mistakes. So if my mistakes help you guys to learn what not to do when you go into practice, that's great. I would love to be sharing all of that with you guys for that sake. So, mistakes that I have made. Now, this is essentially going to be my goals. So my goals that I'm going to share with all of you are mistakes I have made. Granted, it is day 2, but for me, now you have to understand your level of comfort in your learning. So for me, I want to be as soon as I can. So I never want to be comfortable per se. The moment I feel comfortable is the moment I need more challenge. And that is one of the reasons why I absolutely love acute care. You are constantly problem solving through things. Communication is always on the forefront. You are always talking to nurses and to the other healthcare professionals, a lot of interdisciplinary communication. And I was talking to a few doctors today who had called on our phone, and they had it was just brief, just like communicating, when are you going to go see this patient, what happened during the session with this patient, and stuff like that. So I mean, you won't often get what happened during the session because they will see it in the note, but if they need it during that time, there can be many different reasons for having a phone call with someone, why someone calls you. And it's just so much, the first thing that I want to say is so much fun, but professionally that's not the best thing to say, I feel. But I absolutely love it. When someone asks me how it is going in field work, I am like ready to pounce on them to be like, it's so fun, I absolutely love it, oh my gosh, this is so awesome. But I'm like, keep your cool, Jasmine, be professional. I'm like, it's great. But then at the same time, I'm like, it's so great. So there are times that they'll see me, and in fact, I'm pretty sure people have seen me already with my squinting eyes, because I am smiling under my mask. I may have my mask on. My mask will be on, but I will be smiling so much you can't even see my eyes. So one of the good things of having the mask is my smile is not as obvious. I am oftentimes just smiling away because I'm so proud for the patient. I'm so happy to see how they are progressing and the feelings they are feeling inside for their successes, and the tiny success, the tiny things that they are able to do make a huge difference. And it's just so incredible to see how they're like, wow, I did this myself. Oh, it's so nice to be able to do this again. I love it. I absolutely love it. And I love when I see that the healthcare team is all very passionate for what they do, stuff like that. I can't hide it. I am just like, oh, maybe eventually I have to tell people that my face is just fixed this way, so there's nothing you can do about it. You can judge me, but that's how my face is. But so thank you for the mask, because the mask helps hide my smile so that people do not see me smiling away all the time, because I'm just so happy at being there, having this opportunity for field work in this setting. Again, I never thought I would be in acute care, but hey, I've done so much acute care already, and even from the first time that I was in acute care for field work, I fell in love with it. I loved how fast-paced it was. Granted, I'm still learning how to keep up, and one of my other mistakes I'll be sharing with you guys is, so documentation in this electronic medical system, there's like 20 different about 20 different sections that you need to fill out, and majority of them are just like clicking a button, clicking buttons for each of the areas within that section. And you have to filter out what are the important sections. Do you really need to go into that section? So one of the things for me is that I've been filling in too many sections. My supervisor, because I asked him, I said, what can I do? I find myself spending a long time on notes, and I spend about an hour for one note, and he himself is like, you spend a good amount of time. You should spend more, like 20 minutes. Typically people spend 20 to 30 minutes. Now I do have to ask, guys, for past students and for current OTs with students, what is the average amount of time that your fieldwork student takes when doing their progress notes? Because I know that it's all different. So in my case, it's a little different because he is going based off of everyone that he has worked with, and so it's not specific to the setting. I believe I'm the first student for him in this setting, so I understand that might be a little bit of a difference, but I'm still going to aim for the 20 to 30. It's possible. He finishes his notes so quickly in a very brief period of time. So I want to get to that point, and what I'm going to do is catch myself in duplicating information, because there's so many areas for filling out information. Maybe I will start from the bottom where it has all the areas that you put in, like their upper body strength, range of motion, and their goals, how the treatment session, what you did in the treatment session, if it was a treatment session, and all of that other information. I will fill in that first before I do my narrative of everything. And also I need to be I want to be more smooth in knowing where to navigate to. So for me, I'm finding myself needing first, rather than going into the note and then going out and looking for the information, I have a better idea on where I should generally check for the information I need, which is for me going to be in the patient's history, in the physician's note. I check there, and then I grab the information that I need for their past medical history and for their current complaints and for their current diagnoses. Oh my goodness. and all of that. And then I also, in the acute care setting, I'm probably in skilled nursing and inpatient rehabilitation. There will be a lot of lines, and acute rehabilitation, there will be a lot of lines that you have to work with. And I mean the IV lines and the tube that goes inside the nose, and let's see, the one that goes on your finger as well. And you may have, so those, some might have the heart telemetry, which is the one that is to monitor their heart rate, and basically a lot of wires. You're just gonna have a lot of wires that you have to work with many times. And so if you take the patient out for a walk, you'll need to unplug everything, and you'll need to adjust the bed, lower the bed, remove the bed rest, bed railing, one of them, and then remember to put the bed railing back on, but not to put on all railings, because you need to have at least one railing off so that it's not it's not restraint of the client patient. And that's how it is in these facilities, and that's how it was in the other facilities that I did acute care in. If it's different in your facilities, please write it in the comments below, because the reason why I am sharing all of this is to help prepare future students when they go into fieldwork. What can they expect to go through? And having these resources can be very, very helpful and very anxiety reducing for many people, which is going to be great if it does. And if it does, please do let me know, because I want to make sure I am helping you in all the ways I can. And the documentation system, as I said, is I'm learning how to choose the priority areas, and then navigating the hospital. I get lost in the hospital all the time, and recalling information from the session. So I'm now having my notebook with writing down key information, but for the next sessions I'm gonna bring in this little template that has all the information I want, that I'm gonna put in my use to find chart review information, and then when going into the session I'll bring it in. And we'll see how that goes. I'm gonna try that out. So I'm definitely, in this first week, I'm trying out a whole bunch of different techniques, seeing how they work for me, and keeping that communication open with my supervisor so that we both are on the same ground, understanding what works for my learning and what works for him, on how I can be a better student for him. That's what I want to share for today. And again, please feel free to share more about your experiences, what is similar and what is different from your experiences, so that again the future students who see this video can see your comments, can see this video and get a sense of what acute care fieldwork can be like for them, and in general for fieldwork, what they can expect on like documentation. How is documentation going to be? It's not all the same, but you get a general sense that you probably want to have the patient history, what they're here for, and their prior level of functioning, current level of functioning. If you work in different settings, please do share what it's like in inpatient rehab, acute rehab, hand therapy, all the different settings, because it's going to be so helpful to the future students. Because again, OT is all about advocating, and we also advocate for each other and create that environment for each other that is going to help the students to learn as much as they can, so they can go out into the field as prepared as possible. Alright guys, so this is OT Life Hacker here, and I'm headed out. You see it's getting sort of dark. Not really. It's just almost 7, so that's fine. But I am headed out to go see if my significant other is home before me. He is in the, he was at a bunch of different facilities today. And so we'll see who gets home first. Likely he's home first, because he's definitely more efficient than I am. I'm definitely working up that ladder. Alright, bye guys.